Ladies and gentlemen, I am going to tell you something about the sinus problem. Sinusitis is quite common problem seen in every age group, in children, in middle age, in older age group. The problem starts from mostly with the nose. The septum is deviated, this is called as a D.N.S, deflected nasal septum. You can see in the Love the Nose conference in Manila, Philippine, I represented Pakistan in that sinus problem should be immediately, treated. Otherwise, it gives to various other complications. Complication to the ear, complication to the throat, tonsillitis is there. With sinusitis, there is a post-nasal discharge, dripping. Patient becomes too much upset. There is a lot of pain due to the frontal sinus problem, frontal sinusitis. Then heaviness on the face. The patient is having something like depression. His office work is upset. If he is a student, he cannot study properly. All the time he is doing shoo-shoo. He has to put the drops in the nose. Because the culprit is nose. Either there is a deviation of the septum. Septum is not in the center. Like a motorway, if you travel, there is a divider. But if it is deviated like this, the traffic will be upset. In the same way, nose is breathing about 20 to 25 times in a minute. And there is no rest to the nose till he is alive. Patient is having some problem, especially at the night. He becomes more upset. I will tell you very frankly, our conference in Washington, DC, Nose 2000 and Beyond conference, Professor Karen, he is standing with me. He told that we should do the septal surgery if it is required. We should remove the polyps from the nose through the functional endoscopic sinus surgery. FES protocol, that is now the latest, so that recurrence of the polypi should be less. Otherwise, the operation of polypus was notorious. That recurrence again takes place in 6 months' time. Patient again comes to the clinic that I have got this problem. I have got my own, this RANA E.N.T center opposite KUALALUMPUR College on the J Road, Lahore, Pakistan. I'm doing it for the last 30 years. I've done thousands of operations here. We have given relief to the people. No doubt, people are benefited. But only thing is, if they are, responding to the doctor, people get operation mostly and they don't turn back. If you get it as a bypass surgery, you have to go to your doctor again when the surgery of bypass or your stent has been put or angioplasty. There is a relationship or a constant follow between the patient and the doctor. In the same way, nose is the same. If you don't keep you don't remain in touch with your doctor, then there is a recurrence problem. And the recurrence problem is a nuisance problem. Sinusitis is very bad in that respect, which is soft-footed disease. Patient is not aware that he is having a sinus problem. When you get, before it used to be very simple, as I have worked in MAYO hospital, you can see this, my photograph in MAYO hospital, that X-ray P.N.S used to be the basic proper information. Advise the patient X-ray P.N.S, paranasal sinuses. There used to become some picture out of that. We used to do the surgery. But now, with the grace of Almighty Allah, Pakistan is at par with any European or American, hospitals. That we have got the CT scan. And CT scan, especially with the FES protocol, if we advise the patient brings that scan, we can visualize where are the polyps. We remove them. Patient is absolutely fine. Okay, no problem. Sinus problem is a tricky problem. It gives rise to even tonsillitis. If there is sinusitis, there will be dripping, then you have to remove the tonsils. And if there is an ear problem, it can lead to the deafness. Though we should not take the sinus as simple. I organized the third SAARC E.N.T conference in PC Hotel, Lahore, where plenty of people they came, especially Professor J. Wright, Professor Alauddin from Bangladesh. He was the president of SAARC countries. Sitting with me on the breakfast table, and they told that this area of about 2 billion population, India, Pakistan, Bangladesh, Sri Lanka, people are having sinus problem too much. We should deal on an extensive level that people should be educated. Sinusitis is a soft-footed disease. It should be dealt nicely. I went to the E.N.T conference there in Manila, Love the Nose conference. They also told that the sinuses should be clear. If they are having some fluid or some polyps in them, they are going to cause too much nuisance. I am sitting and I am chairing the scientific session in Manila, and also one conference it took place in Malaysia, naming the 10th Asia OCEANA conference. There again the sinus problem was discussed, and there was state-of-art lecture, and I am standing with the delegate who were there in the KUALALUMPUR E.N.T conference. In the end, I am thankful to you to listen to this lecture, and my topic of this sinus problem is very important in E.N.T. It is one of the 3-4 major problems which we see in the E.N.T specialty. Thank you very much.